I don't know, what should I say? Here we are. Yeah, I think it's really amazing. We started to prepare this conference in 2019 and postponed it 4 times. And this time, November 21, it has to happen. And again, we are here. I mean, we still are very surprised about the commitment from all our partners and our colleagues to make this happen. And we are really overwhelmed by the support of organizations and also the number of registration for this conference. In our timeline, since we are organizing conference, I think it's the first time that we had to deny access because, as you can see in this room, we are fully booked out. And this is really, again, very amazing and surprisingly for us. And this was actually one of the most frustrating things in organizing this event, that we really had to deny access for last-minute registrations. So again, thank you so much for being here. And I would also like to welcome those who follow this event online. We have a live stream, as you know, from this room through the entire conference. And we have, I think, 150 people or even more with us. For me, this is a personal highlight anyway and a milestone at the same time, because after working 30 years in this area and for correlation for more than 20 years, it's really unbelievable numbers also for me. I will retire at the end of this year. So it is, I'm not sure if that, I think you waited for this moment. That was a plan. But of course, so it is an excellent opportunity for me to meet so many friends and colleagues once again right now. Let me thank a couple of partners who helped to make this true. We are particularly grateful that we have such a diversity of partners with us from community organizations from East, from West, from community up to UNODC, WHO. So this is really also an amazing experience once again. But let me thank in particular, of course, Sananim and Jiri Richter. Without him, that definitely would not have happened. And as well the European Network of People Who Use Drugs with Christos Anastasio and Matt Southwell, who were crucial partners to prepare this conference. Last not least, the Eurasian Harm Reduction Network with Ghana Dobrag, with their continuously input for the program of this meeting. And again, all the other partners, which would take too much time to name them all. And last not least, I want to thank our host organization, the host organization of the Correlation Network, which is a local service provider in Amsterdam, the Regenboog Group, and also without their support to support and help an international network as a local service provider is really extraordinary and is also really very crucial for everything what we could do. So COVID still has a great impact on all of us at home while we're traveling and also during this meeting because of the restrictions and safety measures we have to apply. Everyone in this room is vaccinated, recently tested or recovered from an infection. But still, please respect very carefully the necessary rules by wearing the mask and by being a little bit reserved with greeting friends and colleagues. We provide test kits at the entrance and masks at the reception desk, and we can bring you in contact with medical staff if something like that is needed. COVID, of course, also impacted our daily work, and that will be reflected during the discussions we will have during the next couple of days. Harm reduction definitely demonstrated to be an essential part, in particular during the period of the lockdowns, and that was also acknowledged in many cases. At the same time, harm reduction is continuously under threat and faces challenges when it comes to funding and service provision. So actually, I think it is as it always was. There is hope, there are challenges and opportunities, and closer together hope, challenges and opportunities are close together, and harm reduction will move forward. This conference will contribute to this movement, and I hope we all will benefit from our meeting at least a little bit. Thank you. Yeah. So now I introduce my colleague, Katrin.
Welcome. I will be much shorter than Eberhard. But I will, in contrary to Eberhard, I will stay at correlation, so I hope you're fine with that. But thanks. But I wanted to say, Eberhard already said, we were really overwhelmed by the number of people. So we have 440 people, I think, in total. We just were discussing how many countries we have here. It is about 35 or 40 countries, or even more. We will be probably able to share that later on. And this is something I think we never had before, such a huge group of people. And it is probably because we all know, I mean, COVID forced us to stay at home and meet only online. And this is probably why we really can cherish this meeting or this conference so much. And yesterday and this morning already, many people came to us saying, oh, thanks a lot for organizing that. Someone even said, you are so brave to organize that. And then we thought probably, yeah, we are brave. No, we are all brave for being here. And also there is COVID. I think we will all stick to the regulations and try to be as safe as possible. Looking to the countries, yesterday and today I saw lots of Finnish people in the breakfast room and then during dinner. I thought, oh, probably the Finns are the ones who will come with the biggest delegation. It's not the case. For sure, we have the Czech Republic or Czechia with more than 30 people, but they are directly followed by the Ukraine. So this is, and the United Kingdom with 28 participants, and only then comes the Netherlands and Finland together, both with 28 people and organizations. So I think that's just wonderful. So I won't continue any longer for now. What I want to say before I leave and introduce shortly Ricardo is we will have a kind of online voting system set up. This will not be displayed right now, but later on when the first panel comes up, there will be a question displayed. After 15 minutes, you will have another question, and in the second panel, the same procedure. You can go to the link, which is displayed below. So I think it's the link slido.com, not so difficult. And there is a code, #EHRC21. It's also on the bottom of the slides. And there, with your iPhone or with your smartphone, you can answer the questions. And I think this is something Ricardo can probably somehow build into the plenary discussion, so that will help. I now would like to ask Ricardo to come to the upstairs. He is the one who will moderate and lead us through the two panel discussions. He is the founder and president of Unite, the Global Parliamentarians Network to End Infectious Diseases. He's a medical doctor, university professor, politician, and author. He is currently serving his third term as a member of the Portuguese National Parliament. Besides that, he has always been a loyal supporter for us in the harm reduction field, and I'm very happy to have him with us. Thank you.
Hello, good afternoon. Thank you for your kind words, and thank you, Eberhard, for your kind invitation. It's great to be here. It's great to be back. And I don't know if you feel the same, but I feel everyone else is much more beautiful now than 2 years ago. But I guess I've been closed in my room for too long, looking over Zoom. I'm really excited to be here because it means that, and I think what was mentioned before, the number of people wanting to come here is a clear sign that people not only need human interaction and want it, but we all want to continue pushing our agenda forward. And that is the amazing work that the organizations that put together the conference have been doing and have continued to do throughout this pandemic. And I also congratulate you not only for the work putting the conference together, but being able to continue your work in such difficult times. And I know it was with the support of many NGOs, with many supporters across Europe, and as a fellow European, I thank you. I thank you for that. I'd like to greet you all now officially to the plenary opening session of the 5th European Harm Reduction Conference. Thank particularly Correlation, Sananim, and the Eurasian Harm Reduction Association for inviting me to moderate this important discussion, and also for trusting Unite, the global network of parliamentarians of which I am honored to be the founder. We are a group of parliamentarians from around the world, and we will be contributing with some of our members also in this discussion. As was mentioned, I'm a medical doctor trained in infectious diseases, but I'm here as a member of parliament, but also as the president of Unite. Currently, we are present in more than 80 countries around the world, nearly 200 parliamentarians, and we continue to push forward. And just recently, we have founded the International Forum on Global Health, which is a joint platform of 14 different parliamentarian networks that have come together to discuss and push legislation at a global level on global health issues, of which, of course, drug policy is an important pillar. But despite representing a global organization, I can't help but mention that I'm also coming from Portugal. And the reason why I think this is important is because Portugal celebrates this year 20 years since we decriminalized the use of drugs in our country. And, you know, for many years I've heard that Portugal is a pilot, it's an experience. It's proven that it worked. And I think that it would be important to see many other countries follow the lead. And I've seen in the conference that I think the name of a session that is coming up throughout the days is Isn't decriminalization the logical next step? And I think that we need to discuss this very openly and to see how harm reduction has become part of our daily lives. But 20 years on, and I think this is also an example for all of us, we have pushed for decriminalization 20 years ago, but now we have been staying too much in the shadow of the decriminalization. We need to continue pushing forward our agenda, making sure that other aspects of drug policy are incorporated. And we lost, throughout the pandemic, one of the most important politicians who fought for this, and he was the former president of Portugal, Jorge Sampaio. He was not from my party. I'm a social democrat, he's a socialist, but on issues that mattered, like decriminalization, we stood together. And I think we all can agree that when we're talking about human rights, when we're talking about saving lives, when we're talking about ensuring well-being and quality of life, we need to make sure that party politics stays away and that we are able to join hands and move together. That being said, I would like to welcome our panel of speakers who will be speaking here today. We will have various representatives from different organizations. As was mentioned, we have the interactive questionnaire, and you should check out your smartphones and use the website and the code that we have behind me. And before we continue, I'd like to invite some of my colleagues to give some welcoming words also. And firstly, we have Milena Jonova, who is the Councillor for Social Policy and Healthcare of the Municipality of Prague. She co-founded and led Ritmus, an organization focused on the development of supported employment. And since the early 2000s, She has been a key political figure in Czech politics, supporting the implementation of quality standards and social services. Thank you for having us at your city.
So firstly, thank you very much for inviting me here. I'm very glad to be here in a so nice atmosphere. So, dear colleagues, ladies and gentlemen, I'd like on behalf of the city of Prague, it's my honor to welcome you here in our beautiful city at the 5th conference, European Harm Reduction Conference. I'm glad that you have chosen Prague for sharing learnings and experiencing and discussing challenges we face across the Europe. Many say that Prague has a lot to offer in the field of harm reduction, but I sense we also have a lot to learn. For example, the ongoing pandemic has shown how much there is to be done in improving in interagency cooperation and system integration. Also, I know that we have not, that our legal framework is not robust enough to ensure harm reduction services provide in more effective way. Also, I know that we are still struggling to appreciate and apply evidence-based policy in policy making and implementation, and instead of this, some local government representative here in Prague, for example, use drug issues for scoring political points, which impede serious policy solutions. So there is a lot of ahead of us, and because of this, I'm really very happy that this conference is taking place here in Prague. I believe that we have great opportunity to learn from others and also highlight the contribution harm reduction services makes to society. We all are going through a difficult period of time due to the global pandemic, and it's becoming clear that we are far from over, and we still don't have clear what's the longer-term impact of pandemic, for example, for the mental health. And we can see in the real time what are changes in social cohesion or behavioral patterns. But despite of increasing pressures, we have an obligation to continually review our services we provide, our policies we pursue. So saying all this, I believe that the conference is going to be a great opportunity to share experiences and learn from each other. And I wish you successful time here in Prague. And also not just here in the conference rooms, but also outside, because Prague is a beautiful city. And I hope you will enjoy not only this program and the conference, but also your time outside the conference room. I'm very sorry I'm not able to stay here for the whole day. I have to go to the office because some other work I have do with colleagues from a health commission. We have the General Assembly tomorrow, so I will have possibility to see you, to meet with you in the evening, and then during the Friday program. So I'm very happy to participate somehow, and thank you very much for your attention.
trying to get the mic working. So thank you, Milena. If I know this crowd, they're going to enjoy Prague very much this evening. Our next speaker is Jiri Richter. We're going to listen to Jiri Richter. Thank you so much for being with us. He is the director of Sananim and president of the Association of Non-Governmental Organization, which is part of the Governmental Council for Drug Policy Coordination.
I promise to be shortest from my previous speakers, because some I'd rather sing than to have speeches. First of all, let me say I'm so happy to see you all, but even more that this important event could happen. It was amazing work done by not only Sananim but also Correlation. I'm proud to have the possibility to co-organize this conference in Prague and help a bit to make our services better and to help our clients to live better lives. It's also the biggest present for Sananim we get, just because we have 30 years anniversary last year, but because of COVID we didn't celebrate it. So thank you very much for having it in Prague and as a celebration. Reason why I have my hat. I take my hat off to Correlation for the amazing work they do for public health in Europe and for give us the chance to learn and to what is there to learn and share, of course, learn and share. Thank you, Correlation. I'm sure harm reduction saves hundreds, thousands of lives, families from execution, helps to ordinary live life for our clients. It's a big success. On the other hand, however, thanks to all of your and its successful work, it seems harm reduction is not one of the biggest problems anymore and in most of our countries. And this is what's some of my concerns at these days. Finally, I would like to welcome all those working on the field, representatives of important organizations, representatives of cities. Special welcome to my old friends, or Sananim old friends, and experts, those helping us 30 years ago when we start our services, those representing drug users community. On the end, we are at threshold of capacity, and we are a colorful community using different drugs. We are also facing another wave of COVID. So, behave safe, feel safe, and stay safe. Postscriptum, tomorrow there will be our mobile unit, ambulance car outside on the parking place, so anyone who could see how this could look like is very welcome there. It's at parking. Enjoy your stay and have a nice day in Prague. Thank you very much.
Thank you, Jiri. And now we're going to have a pre-recorded message. I'd ask the technical staff to prepare the message to go up. It's a message from Dr. Hans Kluge, the Regional Director for Europe at the World Health Organization. Dr. Kluge is a medical doctor and public health expert with more than 25 years of experience across 3 different continents. We could have the message, please.
Dear colleagues, dear harm reduction activists, dear friends, first of all, let me thank you for the opportunity to be with you And my thanks to the organizers for putting together such a rich, exciting program, reflecting the diversity as well as the commonalities across the 53 countries of the WHO European region. What I'm particularly happy to see is the increasing representation of professionals and activists working on harm reduction from countries in Eastern Europe and Central Asia, which is my priority. Throughout my own career, I have always prioritized serving the vulnerable and have had the opportunity to do so at close hand on several occasions, supporting people living with TB and HIV, people in prisons, and people who inject drugs. This has shaped me personally and professionally, and is among the reasons why I wanted to be with you today. This experience emphasized to me that we cannot talk about tangible results in the field of public health unless everyone is included, leaving no one behind. COVID-19 has underscored this. This is the very idea of universal health coverage, and is also the bedrock and principle of the European Programme of Work 2020-2025, United Action for Better Health, that every WHO member state in the region has committed to, working together to leave no one behind. This conference is taking place at a very opportune moment. As requested by member states in the European region, we are now developing a new European action plan to guide countries towards eliminating HIV, viral hepatitis, and sexually transmitted diseases by 2030, in line with the Sustainable Development Goals. This action plan will be people-centered, and it has to be innovative. If we are to reach the vulnerable and marginalized, among them people who use drugs, we look forward to learning from you, sharing examples of successful collaboration and good practices that can be copied, adapted, adopted, and scaled up, and that we can work together on and include in the new European Action Plan 2022-2030. Once again, thank you for your invaluable work. I wish all of us a fruitful, inspiring conference. Spasiba vam bolshoye.
Thank you, Dr. Kluge, and I do hope that everyone is included in the discussions on the action plan for 2022-2030. I was told, and since universal health coverage was mentioned, we've heard about a lot of the different groups represented here in the room. There's one group that I was told that has a very strong representation in this conference, which is the sex workers community, without whom universal health coverage is also not possible. So thank you also for coming out and being part of this conference. And now it is my great pleasure to present the speaker of our first keynote session in this conference, our esteemed colleague, my dear friend, Alexis Goosdeel is the director of the European Monitoring Center for Drugs and Drug Addiction. Many of you know him from the past. He's not a European bureaucrat. He comes from the ground like many of us. He was one of the founders of Modus Vivendi, a Belgian NGO working in harm reduction, and has spent much of his 30-year career working in the field of public health at the national, European, and international levels. And I must say, on a personal note, he has the most fantastic European agency office in all of Europe, because it's based in Lisbon, but I'm not biased. Alexis, you've been doing an amazing job. Thank you for everything. The floor is yours.
Muito obrigado, Ricardo. Well, you know, I would ask you some help, because people who are looking or watching streaming programs, they have the impression that the room is empty. So I would like to tell you, welcome, good afternoon, harm reduction community. Are you ready? Stronger, stronger, stronger. Thank you. This was for anybody who has doubt about how alive and useful and important is harm reduction. It's a privilege, I feel very sincerely, for the EMCDDA and for myself to be invited to deliver this keynote speech and to co-sponsor part of the event. I would like to address special congratulations and special thanks to Eberhard and his team, to Correlation Network. I would like to thank Ricardo and his colleagues from Unite. I want also to thank all the networks, all the organizations that are supporting this event. And I want to start with a very special message for all of you in the house, in this building, but also online. It's a special tribute on my behalf and on behalf of all EMCDDA staff to all harm reduction services, professionals, and associations of people who are using drugs for the incredible commitment, for your resilience, as shown not only but especially during the COVID-19 pandemic. Congratulations to all of you. You know, Eberhard has many talents. What I did not know is he's extremely good in drafting very precise guidelines for speakers. The only problem, following the guidelines, I ended up with 80 slides. And as Ricardo reminded me that I will have 10, maybe 11 minutes, I decided finally no slides. So that's the good news. If I'm asked and trying to think about how was harm reduction 32 years ago, when I started working in harm reduction field, this was before harm reduction was even known as a concept. It was the HIV/AIDS years. It was a work and a concept in progress. And I need to confess that it was an extremely important experience for me and for all the colleagues with a technical and a professional background for health professions, because we had to realize and to discover drug users, moving from looking at them as a clinical category from our training to what I would call encounters of the third kind, which is people, human beings, and social and human encounters. And this is why when we started in Modus Vivendi organizing the first trainings on harm reduction for professionals in Belgium, we invited professionals, but we asked them first to listen to users, to listen to the peers who were participating in our peer prevention program called Boule de Neige. A question that for us was central was the role that hepatitis played. We start with non-A, non-B, with A and B, and we ended up a few years later with Hep C. And HCV in Belgium has been the key to activate and develop harm reduction, much more than HIV. The reason being that the number of HIV and AIDS cases in Belgium, especially related to drug use, was very low. So there was a kind of the denial from professionals, from treatment centers and other institutions saying, no, it's not for us. It's just a problem for other groups. What has been the evolution, and of course, I will not make all the history, don't be afraid, but I would like to start with one starting point very, very important, is to remember that 30 years ago, there was no consensus at national level or even in Europe about what was and what should be harm reduction. And the European Commission has played a very important role, a key factor for exchange and knowledge building. For instance, thanks to Alexandre Berlin, Dr. Alexander Berlin, support program for study visits, I had the opportunity to bring all my local teams from Belgium to the Netherlands to learn what is methadone bibus, what is street work, what is the work on the field. And this is where I met people like Franz Strootman, Cas Barendrecht, who published the first manual on peer prevention. It started with the support of the Commission. Between 1999 And 2016, we have moved little step by little step, but we managed to reach the UNGAS with a common statement of the EU member state unanimously. The first time we spoke with one voice, and that was including harm reduction and harm reduction activities in the statement. There is also the successive EU drug strategies and action plan, and of course, my friend Jindrich was reminding me that it's frequently under the expectations of activists or some groups of professionals, but we should not forget that's the consensus document between 27 countries. And today, thanks to the Commission, an idea that maybe was looking like a nice bureaucratic fantasy, there is the forum with the civil society, and it's working. And I see on the social media, or some of you who have been elected, you are so proud to participate in that forum. That's another of the achievements. Of course, it doesn't mean that we got it all and that everything is perfect. So there are certainly two questions that I think are still important today. Is harm reduction as a concept really understood? And is harm reduction ready for the future? When we look at the new challenges, I think we have a lot of lessons learned from the COVID pandemic. And I mentioned already the resilience of your services and of all of you as professionals and activists. I think you have demonstrated, and sometimes together, and I'm very proud that the EMCDDA managed to be closer from you and more useful every time it was possible and required. There was a huge capacity for innovation and adaptation. And you have shown the possibility to have more flexibility for services, but even sometimes for legal frameworks, for instance, in countries where take-home methadone was not yet allowed. But drugs are still mostly understood as injecting heroin, while the problem is much broader. And the founding principles of what really is harm reduction are partly ignored. And here we face a specific additional challenge, is that those who have been the masters or pioneers, those who invented in their day-to-day challenging life with AIDS patients who were also people using drugs dying in their hands, they retired. Some of them already passed away. And we need to make sure we ensure the transmission of those concepts, the transmission of the know-how and the experience. And unfortunately, we have another example that was mentioned by Eberhard in the opening. And I would say that, okay, Eberhard, everybody has the right to retire and to have a private life. I wish you the best possible retirement, but I wish you stay in contact with us. And I want to say a special thanks to you on my behalf and EMCDDA for all the good work done together. And we have still a few weeks, we have a few things we will do together. Thank you. So I reached the end of my presentation. The starting point to see where we can go together is, first of all, to realize that today the drug situation can be summarized with 3 words. Everywhere, everything, everybody. Drugs are everywhere, more than ever, more potent and cheaper than ever. Everybody can have a problem with abuse of dependence of any kind of substance at one time in her or his life. And also, everything can become the object of an addiction. And I don't mean gaming or gambling, I mean any kind of substances that we find are being used or abused and that require also harm reduction intervention. For the same reason that today we also need to include in harm reduction, you already did, in fact, COVID-19 prevention. We need to start from the risks. In French, we don't speak about harm, we speak about risk, which I think, in my mind at least, is broader. And it allows to encompass other risks behaviors, other profiles and patterns of use. And also this means that we cannot accept today that we summarize what harm reduction is just with needle exchange programs or methadone. There is much broader, and we need to work on it together. I remember from the exchange with the harm reduction community that you expressed sometimes some need for support to communication, to share and communicate your experiences. And this is why we have considered the possibility to organize an academy on scientific writing, if useful. Co-production is part of and at the heart of our work. And I finish with the new offers for cooperation from EMCDDA. First of all, I mentioned co-production. More than ever, we are going to continue to develop more activities in partnership with the different partners. And in that context, we have a specific partnership with Correlation for the drafting and the publication of the best practice on drug consumption rooms. And this is one of the things on which we are already working now. We have a lot of achievements from EMCDDA side, and here I need to pay a special tribute to Dagmar. I know she doesn't like, she will feel a big emotion, but the emotion is as big for us because many, if not all the progresses that the EMCDDA has made in this field is thanks to the commitment, to the efforts of Dagmar. Now, Dagmar also went for retirement, but the good news is we don't have another Dagmar. First, she's still there, and we are still in contact with her, but now we have Isya. So Isya is working with us, and will start in February, not taking the shoes of Dagmar, but bringing around shoes. Welcome, Isya. And finally, I'm happy to announce that, as discussed with Eberhard and the colleagues from Correlation, sorry, I'm a bit stressed, we are launching a new platform that will help us to offer a room for communication for the harm reduction services through the platform, but not with the control of EMCDDA on what you do. It will also be an interface for us to work with you. Why? Because one of the fields for which we want to offer more and better support in co-production with you is support to evaluation, because as we see, for instance, with drug consumption rooms, I think monitoring and evaluation are the two sides of the coin. And I mentioned the coin because it's more and more needed to justify to the public authorities the need for financing and what are the results, what is the impact of those programs. And this is one of the challenges that the EMCDDA wants to address together with you. Thank you very much.
Thank you, Alexis. I think it was a very powerful speech, and I would highlight the fact that you emphasize so many ways, and just now with this new platform, the importance of giving the voice to the people and making sure that the people who work in the community, the people who use drugs, are included and involved in all of your decision making, which I know is part of your process and Dagmar's and all of your teams. You guys have been doing a fantastic job. I asked Alexis to sit next to me because you're going to be part of the next panel. And just before we start that panel, so the panel is entitled European Drug Policy and Harm Reduction in both the European Union and Eastern European Balkans perspectives. We'll do this in two parts. We're going to do a first panel more focused on the European Union and a second panel more focused on the Eastern European and Balkan perspective. And we have a couple questions we'd like to put up, if possible, for the virtual interactive questioning. So if you have your smartphones, and you can vote. The website is slido.com, and the password or the code is hashtag EHRC. I'll give you a few seconds to do that. Feels like election night back home. Okay, I think that gives us, oh, we still have more people coming in. I think the picture is very clear. This is very important for our speakers to be able to assess. And so to the question, the EU drug policy is influential and can push its member states to develop and implement evidence and human rights-based drug policies. 60% consider somewhat right, and only 16%, more or less, consider absolutely right, and 17% not really. Quite interesting. Can we have the second question now to help frame the conversation? So the next question is, do you think HR, do you think HR programs have increased or decreased in your country in the last decade? Yes, thank you. On the positive side, more than half considered it increased, although there's worrisome news for 20% that said it decreased. Also interesting for our assessment. Thank you everyone for participating. We'll have a couple more of these interactive questions further on in our discussion. So let's move forward with our first panel. As I mentioned, we're going to focus now on the European Union, and to join me, along with Alexis, we have some other very, very, very interesting speakers that I'm honored to present. The first is Senator Lynn, who is a dear friend, an independent Irish senator and member of the Global Network of Parliamentarians. Thank you, Lynn, for joining us. She was awarded... Lynn was awarded the Senator of the Year award in 2016 by the Irish Times and has a strong profile in advocating for social justice, both outside and within the Senate. Sits with the Civil Engagement Group, an alliance of independent senators seeking to bring civil society expertise. Senator Lynn introduced the Controlled Drugs and Harm Reduction Bill in 2017, and since the first day we met, has always inspired me. So thank you very much for coming. Our second speaker is also very well known to everyone here, Jindrich Vobrovil, the head of the Institute for Rational Addiction Policies. He is a leading Czech authority on drug use that many of you know well, as myself, and with over 20 years of experience leading and developing health programs and social services, he also held the post of the Czech National Anti-Drug Coordinator and Director of Anti-Drug Policy Development and the Secretariat of the Government Council for the Coordination of Anti-Drug Policies. Iga Kender-Jeziorska, I hope I got the name right. Iga is a member of the Civil Society Forum on Drugs and a PhD researcher. She is also co-founder of the Social Drug Policy Initiative, Vice President of Youth Organization for Drug Action, chair of the working group on the EU Action Plan at the European Commission Civil Society Forum on Drugs, and assistant coordinator of the working group on NGOs. And last but not least, Matt Southwell, project executive at the European Network of People. Well known to you all also from the European Network of People Who Use Drugs. Matt is a technical advisor in HIV drug use and harm reduction with more than 30 years of experience and high-level advocate with experience engaging with the UN and other global European multilateral bodies to promote health and defend rights of people who use drugs. Thank you, Matt, for coming. So the way we're going to do this is I'm going to give the word and open the floor to our speakers for a 3-minute introduction, so you can share your initial views. Then I'll launch a few questions which you can pick up, and from those questions we can continue our conversation. And Alexis, maybe we'll leave you for last since you just delivered the keynote. And we'll start with Iga here at the extreme left. Is that all right?
Hello everyone, good afternoon, and thank you very much for Correlation to inviting me to this session. I was asked to tell a few words about the implementation of the EU drug strategy as the Civil Society Forum on Drugs and the working group that I'm chairing in this forum have been very much involved in the monitoring and evaluation of the EU drug strategy that ended in 2020, as well as in the development or drafting of the new document. I guess that all of you more or less are familiar and aware that this kind of document exists, but maybe not all of you had the capacity or time to take a look or read the evaluation that was done by the external evaluators. So for the European Union drug strategy that ended in 2020, that was implemented since 2013, there have been some positive developments and positive aspects, but mainly, fortunately or not, in the area of international cooperation and coordination activities. On the other hand, the results of the evaluation said that there is still some room for improvement with respect to the implementation of demand reduction activities and actions. And in this previous strategy, harm reduction was also included within demand reduction actions and strategic objectives. So it is clear that although the survey, the poll said here that showed that harm reduction services in many countries are developing, there is also a considerable number of countries where the situation either remains the same or is getting worse. From my perspective and also the research that I've been conducting over the last couple of years, I think that there is one main problem with harm reduction services in many countries, which is that there is availability of services quite often, but the access to them is often very limited, which means that we can have huge differences between different regions in a country with respect to the geographical coverage of the services. There are huge differences between the urban areas, so big cities, and the countryside. And in the countryside, in many countries, the services are not available at all, even if the needs assessments show that they are necessary. And also one of the main challenges, I think, is that we have been observing something that we called shrinking operational or shrinking space of civil society. We know that harm reduction services are very often or almost usually delivered by non-governmental organizations, and nowadays the political landscape, the political atmosphere in many countries is quite unfavorable with respect to non-governmental organizations. There are problems with funding. There are problems with political support. So I believe that for the next several years, the new European Union drug strategy was just adopted in December last year. So one of the main challenges will be to make sure that the political support, meaningful civil society involvement in policy making at all stages, including in harm reduction policy making, will be ensured together with with the paradigm in harm reduction and drug policy that is based on human rights and public health. Thank you very much.
Hello, everybody. Thank you for the invitation. I'm glad to see so many familiar faces and some other people I don't know, so I hope we may have time to meet each other during the conference. I have been on different sites. I worked as a outreach worker, as a psychotherapist. I worked as a director of services, providing services in different regions. We ran an agency with 43 different projects in different parts of the region. At the same time, I have an experience from government. So I spent 8 years, for some of you know me, some not maybe, 8 years I spent as a national drug coordinator directly accountable to the Prime Minister. At that time I was also involved in setting up the previous European strategy and shaping or trying to take in active part in shaping of European policy. Many of you know that I am a strong advocate for harm reduction as not only a type of service or intervention, but as a main approach in policy, because we have one option, abstinence and moralistic policy, and on the other side, realistic policy, which is based on the principle of minimizing harms and risks. There is nothing else. I know it sounds simplifying, but I've been in the political game long enough, and I'm definite that anything more complicated, politicians cannot grasp it. With all my respects. So harm reduction should be in the core of the policy, not as a type of service or a type of intervention. That's not enough. Legislation is shaping what we're doing for people. If I have criminalizing policies, what we can do for people in our services is going to be limited. So, in my view, our strategy in 2021 in 21st century is totally failing. I'm very critical. I know Alexis is trying to be very positive, and I know, so let me be the other side. I'm very critical about the European strategy because it's failing, realizing that criminalizing users is the minimum that we should change. I think we should go further, and we have to make sure to, as a European leading countries, European Union should be going further. And if we talk about human rights, prohibition is against human rights, and it's against everything we're trying to do. So, in my view, it's not good enough. I know it's a consensus of countries, but minimal what we should push for should be decriminalizing users. I think the strategy is failing in an ambition of taking a role in an international arena. I spent many years as either head of delegation or deputy head of a delegation in CND, so the UN main body trying to kind of push for new policies and shaping all declaration and resolutions. European Union has been at some point the lead in harm reduction, how do I say that, harm reduction language. When I first came to CND 2010, harm reduction was not possible to mention in any of the documents. In 2016, we managed in Angas to put it in the written language in the outcome document. So I think we should go further. So. And I would like to echo what my colleague said, role of NGOs, I don't see there. So I think many other things, I'm sure we will have a possibility of debating it.
Thank you. So I'm Lynn Ruane. I'm a senator from Dublin, and I'm delighted to be here today with everyone. I suppose I'm going to speak as a legislator, I suppose, as part of this panel, but just to give some context to, I suppose, what brought me to this point. I'm from a community in Ireland that has probably one of the highest deprivation and poverty rates, which in turn obviously increases the prevalence of drug use or the type of drug use within particular communities. And then I went on to develop community addiction programs for 15 years, worked in the homeless sector, and then went into politics. So the thread of my life very much runs into the policy that I try to create, which is why I introduced my very first piece of legislation into the Irish Senate was the harm reduction bill, which is decriminalisation. And the reason I called it a harm reduction bill was because I feel like, you know, like my colleague here, that we can't actually fully realise harm reduction if we continue to see people as criminals for drug use and drugs possession. That bill kind of instigated a public consultation in Ireland that led to conversations to decriminalise drugs, led to a working group. It was the highest ever submission rate to a consultation in Ireland. 22,000 submissions came in. So it shows, again, that the public is way ahead of the political. But what we had in that sense was politicians who now speak about the need for evidence-based legislation, but when it came to this, then they completely ignored the evidence base that they were presented with in terms of drug decriminalisation. So it's somewhat stalled with a kind of another classist, I would say, effort at drug decriminalisation, where on your first occasion of being caught with drugs, you may be offered a health intervention, but thereon after it's a justice issue again, which doesn't really make sense, because first of all, the only people who are going to ever only get caught once are not the people that we're trying to protect and keep out of prison, and the people that are in chaotic drug use or do need extra help. And I just feel that that's another kind of classist effort at policy making. Beyond that then, I went on to develop a second piece of legislation, which is not drugs related, but very much associated with the efforts, I suppose, in harm reduction, and that's to remove minor convictions off people's records. So I have successfully got that through all stages in the Senate, and it will begin its journey in our lower house over the next year, supported by all parties and government. But what I done within that legislation was a little bit of keyhole surgery and went into the drugs law. And I have uncoupled possession of drugs out of the Garda vetting process, so that when people do get Garda vetted for employment or for college or anything, it's actually taken drugs possession, which was lumped in there with murder and terrorism and all that kind of stuff. So we've taken that out and we've placed it, and we've taken it out of Garda vetting hopefully when it all passes this year. I'm in terms of the connection then with EU policy, I suppose at a civil society level, we wouldn't rely very heavily on looking at the EU strategy, but then when it comes to making the arguments in-house, when it comes to government and diplomats and civil servants, we definitely then lean back into the kind of European framework. I think Ireland likes to try be a good European to differentiate ourselves from our UK neighbours. So we do rely heavily at that stage on EU policy and strategy, and I'm looking forward to the panel today and happy to talk about any of the initiatives that I work on in Dublin over the next few days.
Yes, so I think looking at the issue of drug policy, for drug user organisers, drug user organising is a very practical activity. It's focused on things that we do for each other. So it's very action orientated. It's taken us time to come into the global advocacy space and the European advocacy space. But I think the drug user rights movement now is playing an increasingly strong and dynamic role in those spaces. To go back, I started as one of the UK's first generation of harm reduction workers, and through the 90s and 80s we applied harm reduction and in our case also community mobilisation to great success. I thought it was the triumph of rationalism over outdated thinking and often rights abuse thinking in terms of some of the models of drug treatment and rehabilitation at that time. For us to have then gone through 15 years of going backwards in terms of our drug policy, which is well evidenced in the number of drug users leaving drug treatment, which is increasingly a hostile environment, the number of people who have died from drug-related deaths. When the UK left the European Union, I think drug-related deaths went down by something like 20%, 25% in the European Union, 1,000 drug-related deaths in Scotland last year. So that lost ground for me was something really shocking. I thought in the 80s I would be a harm reduction worker all my life. In 2001 I came out publicly as a drug user because I realised this was a political struggle. It wasn't just a public health struggle. No, I saw services that we'd built with drug users dismantled because it didn't fit with the new political message of the time. We've seen our drug policy veer backwards and forwards to catastrophic effect to our drug services. That for me is the very depressing backdrop to the policy debate. The optimistic bit is what happened when I came out as a drug user activist in 2001 is the growing drug user rights movement that has engaged the global system and is now engaging the European system with a moral authority which I think is uniquely powerful. So you can have the debate, you can have the science, you can have the evidence, but we know it doesn't still get through. When you're forced to work in an international space alongside people who use drugs, alongside sex workers, men who have sex with men, people living with HIV, it's incredibly challenging when you're coming in with a discriminatory, judgmental, criminalizing approach. When you're forced to work with people who are the people you're applying that human rights violation to. I think we've seen in the global space, and I hope increasingly in the European space, we've seen the power of that personal testimony, that personal advocacy. And then in addition, we've seen during the pandemic, the power of community-led organizations, the ability of drug users to get information onto the streets, to advise our peers how to manage with the pandemic, how to manage with lockdown, advising people how to respond to the challenges of being drug users and being criminalized in a lockdown environment, spreading needles and syringes, spreading naloxone, spreading healthcare, spreading support, spreading love and affection to our peers. And for me, that is a remarkable thing. And the fact that I've ended my career has moved into being drug user organizing, for me is, I feel very privileged by that we are in this incredible movement that is really transforming the society we live in.
I kept one thing for this session, which is the fact that one of the things we can observe, and it has nothing to do with drugs actually, is that fragmented societies produce fragmented policies, but also fragmented policies sometimes contribute to more fragmented societies. Today we see more violent societies, not only on the social media, but I think the violent speech or hate speech or stigma on the social media or amplified by the social media is not only virtual, is not only on the internet. And I think what we can observe is what it has take is all kinds of what we would call in French, I translate probably bad in English, the figures of alterity. Everything that is different. Women. It's how can we have so many murders of women, and it looks now just like a statistic. I mean, it's reminded. Some people are even discussing maybe the problem is not bigger, it's just that there are more statistics or they are more disseminated. That's the problem also for people who are using drugs. That's a problem with sex workers, with migrants, but also journalists are being killed or assassinated because they don't accept to be submitted. So I think that's important because it has an impact on what is being done or not and what in the future may happen or not. And we see that some countries, we see some indications that the progress made in the last 20 or 25 years, including on drug policies, could go backwards more quickly than we can imagine. And as we said in the joint statement with the directors of ECDC, Europol and myself, is the harm reduction and drug services in general should not pay the bill for the COVID-19 pandemic. And I think if we insist on that, is that there is a serious potential risk for that. So I think in conclusion, what we need on this point, what we need to do together, and I think there is a role as the European Drugs Agency for EMCDDA to share the knowledge, the evidence-based, to learn from you and from your services. It's that we need to rehumanize our policies. Like colleagues in Spain from UNAT, for instance, tell in some of the meetings we had, we need more inclusive policies. Some of the successes during the COVID have been made possible because different services have been working together, and not only those who were just specialized on drugs. A good example, as I see the Greek colleagues and friends, is Athens. The shelter that was open would never have been open before, thanks to that. The problem, we see more precarity. A lot of those new responses depend on external funds that are granted only for 1 or 2 years, and the sustainability is not guaranteed. And to finish, I think we are in close contact with Matt and all the other associations and networks. I think it's important, as we said in Belgium, 25 years we gave the name to auto support group of people who are using drugs. They gave the name to their organization, Citoyens comme les autres, equal citizens like others, and first and last, to build on EU values. If there is no progress at UN level or at international level, it should not prevent the EU member states and the institutions and the professionals to continue and to keep working together, because those values, in our case, they are included in the Lisbon Treaty, and this gives the right to any citizen using drugs in the EU to call for the respect of those rights.
This is a very interesting panel. I have this great challenge of controlling time. I apologize to my colleagues for being so strict, and we're already over time. So my proposal would be I'd share 3 main questions that have been prepared in advance, and we'll have 2 minutes for each speaker, and you pick up on whatever you feel is most relevant to your point of view. So the questions that we had prepared in advance were, what is the role of the EU to ensure good coverage and evidence-based drug policy? For example, ensuring the rights of more marginalized groups such as sex workers. Second question, the EU currently has a drug strategy, but there are lacking programs to facilitate implementation. Is drug policy harm reduction a priority in the EU agenda? What is missing? What are the barriers? What are the steps needed to sustain and extend harm reduction? And what is the role of different stakeholders in this? For example, member states and civil society. These questions could keep us here all afternoon, but in 2 minutes, share your 2 pence, please. And we'll follow the same order.
Okay, so you asked in your first question whether what is the role of the EU to ensure that good policies, harm reduction policies, evidence-based policies, human rights-based policies are implemented in the member states. Now, we know that the European Union's mechanisms or tools that the European Union has to ensure implementation of any policies in the area of drug policy are limited, right? The European Union drug policy documents are recommendation type of documents, and it is ultimately the role of the member states to decide what kind of policies they will implement, adopt and implement. And that's why we have such a huge differences, as we can see, for example, between Portuguese drug policy, and, for example, Hungarian drug policy. So obviously, EU, I believe, has a role in framing the entire political environment and adopt this political declaration that the European Union drug strategy is. But then I would say also that the role of the EU would be to encourage also member states to consult experts, to consult people who use drugs, to consult non-governmental organizations that work in the field, to make sure that they are involved in the policy-making processes. So not only to recommend specific sets of policies, but also to try to influence to some extent on how the key populations and key stakeholders are involved in the policy-making processes at the national level, because that's where ultimately things are happening. Thank you.
Well, it's not as easy to say what EU, what role the EU or European Union and the European Commission has actually. I think the main plus point, which is also stressed in the current strategy, which says, I have it here in front of me, strengthen coordination and synergies and support the central role of EMCDDA, Europol and RATOX. I think that's a very important part of the network that we have. We all have, I think it's from Lisbon Treaty, that we all have to set up national monitoring centers, and it's attached to EMCDDA. So there is some kind of a base for evidence-based policies. I think that is the reason why European Union has actually much less problems. I think we don't see it as much in being involved in direct everyday work with people, with clients, with users. We don't see how important EMCDDA and the focal points are. But if we look globally, if we look from decision-making, then this role is extremely important, and there is no other agency in the whole world as EMCDDA. Not that because I like Alexis, but it's because I really think that. And I think that's why European Union is so much far better in many aspects than the rest of the world. I think it's important to ensure some budget that helps sharing experience and best practices, and that European Union can play an important role. I don't see that so much in the action and in the European strategy, even though it is mentioned there. And as I was very critical at the beginning, I have to agree with Alexis. Of course, there are many improvements comparing to what it used to be. So, and this is very important because spreading the best practice is a key role in developing. I think European Union, we must not forget, it's not only internal thing, that European Union can be the strongest player in the international arena when we talk about the whole world pressure of international law that pushes us to implement the prohibition old-dated policies. And I think there is no other player at this moment but European Union that can make changes.
Thank you. I suppose in relation to the first question as to what the role of the EU, I suppose like you could be trying to answer that all day, but what comes to mind first, I suppose, is the other part of that sentence which references sex workers. So in Ireland, we introduced the Nordic model, which is clearly not a harm reduction model when you listen to the sex workers alliance groups in Ireland who are saying it's actually quite a harmful policy. But unfortunately in that space politically, there's only one or two or maybe three of us that are on the side of the likes of Sex Workers Alliance, and our usual allies in them movements are not the allies when it comes to sex work. So I think the likes of the EU needs to make clear avenues to fund the unfundable in some countries. So now that we're so closely related to the Nordic model, only passing it in the last few years, it makes it very hard for sex work advocacy groups to access any sort of governmental funding to be able to continue to progress and push and antagonise the situation. So I think the EU could play a role there. In relation to the other question that I'd like to pick up on is the 3 steps that we need to sustain and extend harm reduction. And I think it's a lot of the stuff that we're saying. But I think for me, the first one is to decriminalise, and then in line with that, to aggressively, dismantle structural inequality. And then also access to low threshold harm reduction time and time again. You should be able to access any sort of service for any sort of drug use over and over and over and over again. There should be no amount of times you can come back to that door or into that project. And I'm always thinking of, like, say, low threshold hostels and homeless community, and I would sit in them and I would interview somebody, say, that needed a bed or were coming in for a 3-month bed to stay there, and they'd be clearly under the influence in that interview, and it's a low thresh hostel, so that's fine. And then a few days later they would be being put back out on the street for drug use, and it kind of doesn't really make any sense to me, because I'm like, they were clearly out of their heads like 2 days ago when we done the interview. Like, it was obvious. But it's like this mentality exists where I think people have, and you spoke about the language of harm reduction, and I think unfortunately people that don't actually genuinely understand harm reduction have learned the language to benefit their narrative when they're talking about things. So they've learned to manufacture empathy, manufacture compassion, and policymakers are learning it very, very, very quickly so that you can't challenge them, but they don't actually introduce the policy to go with that manufactured compassion and that language that they're learning. So I think we need to really be able to call out that good intentions are no longer good enough. You need to match your good intentions and your nice language that you've learned with actual policy. Thank you.
So, what's missing, I think, is around the recognition that community models are highly effective, and I'm really pleased to hear the growing support and endorsement of that as a principle. I look forward to it being matched with investment. And I think that's the challenge. If we look so my hometown in Bath in the west of England, during the pandemic, we set up a local peer-to-peer needle and syringe program with local drug suppliers and local drug users. Across the UK, needle and syringe access went down by 25% during the pandemic. We know this from sales. In Bath, we went from 28% coverage with fixed site needle and syringe program and pharmacy up to 100% coverage once drug dealers and drug users got involved. So I think we know that community mobilisation works. It's working all around the world. Nigeria is implementing needle and syringe program led by drug user groups. So this is becoming the norm. The problem is drug user groups just don't get the investment to back up the pivotal role that people describe as playing. And I think that becomes the challenge of the whole system as a whole. If you don't have a key group of stakeholders with enough resources to meaningfully take part in the dialogue, it undermines the collective conversation. You need to have different stakeholders equally able to take part in the journey. I think the campaigning work that EuroNPUD has done on peer-to-peer naloxone, for example, has massively benefited harm reduction providers in many countries. Our technical briefings have been used by providers to raise funding to run services on the ground for our community. We shouldn't be struggling to survive as networks. Now, we describe EuroNPUD as a network that is a €300,000 network run on $100,000. And that's fine in the setup phase, but eventually you'll just burn us all out, and then we won't be available as partners. So I think the key is, please back the commitment to peer work with a proper investment in.
Well, Ricardo, I'm afraid for this question, it's better that I remain in the position to listen to what was commented, and I welcome. I want just to highlight that we are just in the middle of the process of adjusting and reinventing our business model and to develop it further into an even more customer-centric organization. The key step is December with the formal decision and endorsement from our management board. And this is based on the long-term EMCDDA strategy that identifies clearly practitioners, which means all of you, as the customers of EMCDDA. So we need also to learn from you how we can be more useful, what is the scientific evidence needed, what is the best dissemination of information that would be needed in order to ensure that together we contribute to, in fact, protect better for any kind of problem or community.
Thank you. Thank you, Alexis. And I'd like to thank all our speakers. I think it was a very interesting discussion. We're going to move now to our second panel. You all lived up to your names, so thank you very much. And now we're going to move. We're going to move quickly to keep on time to the second part of this plenary session, focusing now more on Eastern Europe and the Balkan region. But to start off, before calling on the speakers, let's move on to the other two interactive questions. If I could ask the technical team to put up the interactive questions, please. So, you have to work a bit more to answer these questions. You have to write in a word. So, in one word, what is needed to overcome the funding crisis in the Eastern European region? Please type in a word using the app, and the app will develop a word cloud format so we can see what people consider to be most relevant. Okay, I think this gives us a very clear idea. Political will and money are competing here. Humanity, solidarity, political leadership, understanding. I think it's a very interesting word cloud that reflects many of the feelings of people working in the region. Thank you for participating. We'll move now into the second question, if I may. Ask the technical team to put up the question in one word, once again, what is needed to increase harm reduction in Europe? In one word, so we can put up the word cloud format. Okay, this gives us also a very interesting picture. So decriminalization clearly shows up at the top, especially because it's written with both formats, with an S and with a Z. There's also mentioning education, which is another interesting topic. Money, as always, funding is an important issue. Humanity, political will. Legalization is raised here, which I think is also important to discuss. But affordable housing, which would lead us to the other aspects of harm reduction in dealing with all of the social determinants. So thank you, everyone, for participating. I think these two questions frame very well the discussion for our next panel. And I'm going to present now, I'm honored to present the speakers. And to my right already, Thomas Kattau is the Deputy Executive Secretary of the Pompidou Group, which is the Council of Europe's drug policy cooperation body since 2005. Thomas has also been a professor for political science at Syracuse University in Strasbourg. Thank you, Thomas, for joining us. An applause, please. Mariam Yashi, my dear friend, a former member of the National Parliament in Georgia, and also a member of the Unite Global Network of Parliamentarians. Mariam is a senior level policymaker in global health, sustainable development, and innovative financing, bringing experience from 26 countries of Europe, Asia, Africa, and Middle East. She is also the recipient of the WHO Award for contribution to polio eradication in Europe. Thank you, Mariam, for joining us. Romina Marchion is joining us also. Romina works as international project coordinator at Rome Consensus. She is the coordinator of the Rome Consensus humanitarian campaign and has extensive experience working and living in Lebanon, Syria, Yemen, Afghanistan, Guatemala, Honduras, Belize, and Spain. Thank you for joining us. Gana Dovbak is also coming up to the stage, the executive director at the Eurasian Harm Reduction Association, very well known to all of us. Ghana has 25 years experience working in HIV/AIDS, public health and social care services development for key affected populations, particularly in Eastern Europe and Central Asia. Thank you for joining us, Ghana. And last but not least, Milutin Milosevic, the executive director of the Drug Policy Network Southeast Europe. In 2021, he was elected by the EU Civil Society Forum on Drugs as chair of the working group for emerging drug policy issues and cross-cutting issues. Milutin, thank you so much for joining us. So we're going to follow exactly the same order, and I'd start exactly with, not from the left, okay. I'm a centrist politician. I can go both ways. We can start from the right now and ask each of you to give 3-minute remarks, reminding you that we're discussing about harm reduction, drug policy, reform, barriers, challenges, particularly in Eastern Europe and in the Balkan region. Ghana, the floor is yours.
Thank you. I'm very honored to be here and happy to see you all. And actually, I bring several, as a psychologist from Ukraine, psychologist and culture studies by education, supporting communities for all of these years and have honored to work with the Eurasian Harm Reduction Association team and strong membership for last 7 years. I need to bring to this word, to this hall, some words from the East. Key words for harm reduction, which we are all repeating all the time, and maybe in the broader Europe is not so important, but for us it's a key for now. And the first word is transitioning. And it's not something easy, because that's transitioning from international funding to the domestic funding. And this is incredibly hard process, and hopefully we see in the region during these 2 years, even in the COVID time, that some states really committed to have responsibility and ownership for the services. But still we have countries like Romania, Albania, Russia, Bulgaria, Serbia, Bosnia, and I could know that in the next years we will have problems with more and more countries with this transitioning. The next word is financial sustainability. It's also very complicated word, but in state minds, it's often sound as optimizing the unit cost. And this optimizing the unit cost, it's very dangerous stuff, because from the broad understanding of harm reduction, we are narrowing ourselves to just, I don't know, 100 needles per year and 3 tests for HIV and 1 referral to the test on hepatitis C, and that's it. And very, very strict bureaucratic reporting for this. And this is not harm reduction in per se. And that's why we as association now bringing back or looking forward to the roots of harm reduction, speaking about the goals, where we are with harm reduction. And if we are speaking about health, then we need to think about the mental health and broader health and not only HIV response. And for our funding in our countries, that's very dangerous message, because majority of costs coming from HIV response. And that's why we need to go to the municipalities to see what social services could support us with in the funding of harm reduction. And I need to bring one more word. It's a threats or threats for civil society or shrinking space, we're saying. And it's not only about Russia, Belarus, or Azerbaijan, or Central Asia, but it's foreign agent law, unwanted organizations, using drug propaganda against the harm reduction language and information sharing. That's the biggest threat for our countries, and it's becoming worse and worse with the COVID pandemic and policing in these countries. Yes, we do have the vaccine injustice, and unfortunately, majority of our Central Asia and Russian partners couldn't get here because of the wrong vaccine they have, but also because European Union is not very supportive to the neighbors anymore, and the fortress of Europe now closing their bridges, their gates. So I hope that this conference for us will be encouraging in our rather hard fight for this sustainable transition. Thank you.
Thank you. Yes, how to make the money come your way. That's the big question, isn't it? For all of us. The difficulty is that any entity or anybody relying on public funding feels that they should have priority. And there is always more demand than money is in the kitty. And I'm sure Lynn, as a policymaker, knows the difficulty of making decisions about budgets, where to give money and where not to allocate money. What usually, in my experience, organizations working in the harm reduction sector are very good at, they're very good at outlining the political benefits of harm reduction. Where I sometimes, I must honestly say, see a weakness is the ability to demonstrate fiscal or monetary value. Once an American colleague at a panel said, "You Europeans are really funny. You never talk money in this context, as if that is something immoral. But in the end, you need it, and it can be a very powerful argument." So I would strongly suggest that we look more closer how we can demonstrate the actual financial benefits by investing into harm reduction, because harm reduction should not be seen as a cost. It is an investment. So mind the language. An investment in harm reduction will generate economies in other fields. will generate economies in the prison sector, in the law enforcement sector, or in the criminal justice sector. So there is statistics available from the EMCDDA combined with Eurostat. You can come to amazing evidence that you can demonstrate to policymakers that investing in harm reduction can actually make economies in other policy fields. And this is where disinvestment can happen and it can be transferred. This is not so easy because everybody fights for their budget. But this is where policymakers come in, people like Lynn. They can then convince the decision makers to redirect from disinvestment to investing in harm reduction. We have experienced where this has been happening, where people have tried this. This can be a very powerful force to make money coming your way. And one last word. Oh, I still have 30 seconds. That's fantastic. It's not only money. There's also the question of administration. Administration and bureaucracy, I don't mean this in a negative sense, by the way, bureaucratic administration, is often a huge package to handle and to manage. We can demonstrate with harm reduction, by implementing harm reduction, we can reduce administrative overhead work in other areas. If you're able to bring somebody not into the police station, but rather into a frontline call center or into a consumption room, you definitely can prove that you are reducing the administrative actions or overheads concerning taking down records, etc., etc. This is just one small example. But in the end, combining these, the financial and administrative benefits in investing in harm reduction can be a very powerful tool to make money come your way. Thank you.
Thank you.
Dear colleagues and delegates, it's an honor to join you and to share the experience from the perspective of 18 countries of Eastern Europe and Central Asia. While speaking about the drug policy related experience, I would be able to bring key issues from 3 different dimensions. As the former UN health officer from UNICEF and UNAIDS, I had the honor to be one of the key authors of the very first national HIV/AIDS plans. That was the catalyst of the very first steps in harm reduction initiatives on the ground. As the senior policymaker, as the former deputy health minister and the member of parliament, I had the honor to be at the very foundations of the hepatitis C elimination program in Georgia that currently is a model program, and I'm extremely proud of the legacy of the initiative. Also, while at the ministry, together with very close partnership with civil society organizations, we managed to cancel the policy of mandatory notification of police during the overdose medical emergencies. And finally, currently I'm also chairing the board of one of the universities, medical universities, Tbilisi Medical Academy, and I do believe that we need closer partnerships with academia and scientific institutions to really help and consolidate evidence-based advocacy voice. When speaking about the 18 countries of the region, we have to remember that every single of those states are either post-Soviet or social bloc states with a legacy of oppressive drug policies, and till today we see massive practice of manipulation. Drug policies are used as weapons of manipulation against people using drugs, and that is the main challenge that Eastern Europe and Central Asia has to tackle. Despite the fact that 10 of members of parliaments, together with my fellow colleagues, we were trying to decriminalize drug use 2 years ago in Georgia, we were not successful because the majority vote in the parliaments are still against. They still consider drug use as the issue of marginalization, and as our colleagues said, they don't see as an investment, but rather than a cost to the society, and they do forget the real cost that the society have to pay eventually. Thank you.
Good afternoon, everyone. So, Dr. Massimo Barra was expected to be here today as the founder of the Rome Consensus Statement towards Humanitarian Drug Policy and chairman of the Red Cross and Red Crescent Partnership on Substance Abuse. Unfortunately, due to an unforeseen event, he could not attend the conference, and this is the reason why I'm here as the international coordinator of the Rome Consensus Initiative. So for over 40 years, the Red Cross and the Red Crescent societies have been calling for a more humane approach to address the drug problem. This call was based on a strong sense of humanity, but most importantly, it was based on well-documented scientific evidence. And evidence showed us that harm reduction programs not only work, but they're crucial in saving people's life. So governments need to make clear and urgent moves towards health, humanitarian and right-based approaches. The Rome Consensus statement was created back in 2005 and developed as a partnership between the Italian Red Cross, the International Council on Security and Development, and the Villa Maraini Foundation. The initiative was established to address specific dimensions of the drug problem based on the experience of the past 40 years. And so the aim was, and still is, to promote a health-based approach to drug-related suffering and to prompt humanitarian action in this area. At the very first stage, the Rome Consensus was signed by over 130 Red Cross and Red Crescent national societies, including Georgia, Latvia, Ukraine, Lebanon, and Croatia and Serbia, and also some Red Crescent societies from Central Asia, including Iran, Tajikistan, and Kyrgyzstan. Now we're relaunching the declaration and we're seeking for new partners, new signatories from around the world, and of course we focus on Eastern European countries and on Central Asia because we know it's absolutely needed. And so one of our goals is to establish a wider alliance among governments, activists, professionals, beneficiaries, and of course all the NGOs working in this field. Our mission is, of course, spreading the Rome Consensus globally in order to protect, support, destigmatize, and empower people who use drugs, focusing our action on those who are oppressed and decriminalized against every day. Being here at the conference today, it's a unique opportunity to bring together the civil society leaders, experts, and public authorities from across the world, and especially, as I said before, about this area of the world. We really hope that you will visit our stand, which is upstairs on the second floor, and of course we will be available to give you more information about the Rome Consensus Statement, and we looking forward to, welcoming you there and get your signatory. Thank you very much for your attention.
Good afternoon. I would first like to thank for the opportunity to address the whole conference in the name of the Drug Policy Network Southeast Europe and our member organizations, but also other civil society organizations and people from communities from Southeast Europe. For us, it's a very nice privilege. Thank you very much. Just to say that the region which we count as Southeast Europe is stretching from Slovenia on the north to Greece on the south. We also had some contacts with Turkey, but the situation there is not at the moment favorable for civil society work on these issues. That region has 5 EU member countries and 6 accession countries. And when you hear that, you say, wow, that's great. These people are well established, they work in well established countries, so it goes well probably there. completely wrong. More or less, almost completely wrong, yeah. Actually, the situation is far from that. Out of 5 EU member countries, we can say the situation is good in Croatia, because there is a system which works. It's pretty good in Slovenia and Greece, where the system is going well. It is going worse and worse in Romania, going really critical, coming close to critical, and it's completely critical in Bulgaria, where all the harm reduction programs were closed. So we have, even in EU countries, not so very nice situation. When you talk about the accession countries, we have, again, a relatively good situation in North Macedonia and Montenegro, where we have good steps forward in the last couple of years, but not sustainable. And we already feel some shakes in Montenegro, and our colleagues from North Macedonia, who are really having a good, and who are kind of pioneers for all of us, experience problems with regulating the process so that it doesn't depend on political will. We have a kind of a recovered process for Serbia and Montenegro, and Montenegro, yes, the two, Serbia, which kind of builds again the whole process. We have a process which is coming to the end, the support from the Global Fund in Kosovo and Albania this or next year, and then we don't know what will happen there, especially having in mind the political situation, for instance, Kosovo, which is full of turmoils, and they still could not, for the last couple of years, agree about who will take over the issue of drug because of all the changes. And we have, again, one almost critical situation in Bosnia and Herzegovina, where there is only one volunteer-run harm reduction program which survived. So it really is not as nice as you would see when you look at that corner of Europe and say, hey, these guys are in a good situation. Absolutely not. And actually, this is what Hannah first said. It's about the impact of the transition. The transition was done so bad from the Global Fund. The Global Fund was the only founder. Only, as I said, except for the case of Croatia, all other transition programs completely failed, almost completely failed. So, for instance, in Serbia, when Global Fund left, when they closed the support in 2014, in 2015, all except one harm reduction service is closed. And they were supporting the community of 20,000 injecting drug users. Belgrade, the capital of Serbia, with 2 million citizens and probably the biggest community of drug users, didn't have any service for 4 or 5 years. And at the moment, we have one service from Novi Sad working outreach in Belgrade. That's the effect, devastating effect of a bad transition. And this is supposed to go on. Something which is also for us very interesting is that we think that the health systems, especially in the countries of EU, were not responding to the need. And you can see it from the case of Romania and in Bulgaria. Simply, I mean, the countries didn't care about their citizens who have the issue. Simple as that. Also, for us who come from accession countries, in the acquis, which are kind of the request which is EU posting to us to be members of the club, when we talk about drugs, 99% of everything which is requested from states is about law enforcement. There is only a little bit more in North Macedonia, and just some tracks which are repeating from year to year that there is a need to provide quality health care to some vulnerable populations, people living with handicap, blah, 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 and people who use drugs. Nothing else. We are trying to do something, but our authorities say, no. We are taking the things from the EU acquis and we are progressing. Nothing. We need the support. We need EU to help us, both in countries where they have member states and in countries that are in the accession process.
Thank you, Ms.
We really need it.
So we're very much, we're tight on time. I apologize. After what we've heard, I don't know if any of the panelists, we won't have time to do a formal second round, but if there's any very quick remark that any of you would like to make very quickly. Yeah.
Actually, I would say about the EU support, all our revolutions in post-Soviet countries started with European values. And harm reduction is for all of us, and equally of rights and protection of rights. And harm reduction is the basic European value. And that's something where we all need to have joint vision and joint political support and leverage to our politicians.
Thank you. Talking basic European values. Legally, they are enshrined in the European Convention on Human Rights. That is very important because the Convention constitutes obligations for member states. You cannot politically argue it away. What is set out in the Convention, and even more important, what the principles set down by the European Court of Human Rights are binding for the member states. And each and every citizen can take their government to account if these rights are violated. And amongst these rights is the right to life, from which the court has derived the right to health. And there is now case law also directly affecting harm reduction. Only a few years ago, the court decided when opiate-assisted, opiate agonist treatment, as it's called now, is available in the community, it must be available in detention of any kind, period. Now, unfortunately, this is not made much use of. Other advocacy sectors, such as freedom of press, are much more efficient in concretely drawing on the case law of the court and the convention and using this as a leverage. As I say, when you can use this as a leverage, you're not putting up something for discussion, you're reminding of an obligation, and the violation of an obligation can mean severe consequences, not only for the state, but also a state official who does not comply. So personal consequences even. So it's a very important tool to think about and to possibly make use of. The Pompidou Group, by the way, has developed what we call a self-assessment tool, which includes harm reduction criteria, where you can see whether potentially in your sphere there is a risk of violation, and you can from there on explore possibilities to seek legal remedy if your government does not want to change.
Actually, I had 5 recommendation points, but because of the time limitations, I will just focus on one. And I believe this is a key message when we speak about the EU support and international collaboration. I do believe that for catalyzing changes in decriminalization path, we have to use more widely the existing instruments and conditionality principles of international financing institutions. For example, the World Bank or Asian Development Bank that is very actively involved in the Central Asian region and the whole Eastern European countries, and EU. So if we make decriminalization or human rights-based drug policy a conditionality for EU integration agenda or recession policies or international financial support, budget support projects, that could be a step forward. Thank you.
So yeah, one of the key points is also that we need to build a new and more effective dialogue among all key actors involved in this field. So of course medical professionals, but also educators, law enforcers, judges in courts, for example, policy makers, and in general governmental bodies. So of course NGOs also play a crucial role. But I think to better understand each other's role and responsibility and also learn from each other, sharing best practices is key to overcome all the obstacles that block people with drug-related problems in their attempts to get treatment and overcome their problems, starting from homeless people, for example, sex workers. So it's such a wide range of different groups that should really enhance their dialogue in order to, make sure that these people will also find acceptance in their communities.
As fast as possible. Number 1, health for all and full health coverage. Number 2, human rights of people who use drugs. Number 3, support to community organizations. People who are criminalized cannot create organizations, and that's why. And number 4, regulation of drugs, new, modern regulation of drugs. Thank you.
I thank the panel. I think it was a very interesting discussion. A round of applause for this discussion around Eastern Europe and the Balkan region. We're late on time. I thank you for bearing with the moderator. I did my best. And so sorry, Eberhard, if we went a bit over time. I won't attempt to summarize. Fortunately, we have Matthew to do that. I just say something I said a couple years back at the International Harm Reduction Conference. At the end of the day, it's simple. Harm reduction is equal to love. And harm reduction needs to be equal to love because in true love, it has to be fully unconditional. And so should harm reduction. And I'd end then by inviting to give a final few words and reflections on the current panel to Matthew Wall, who will be giving these closing remarks on the opening session. He is the head of the Department of Politics, Philosophy, and International Relations at Swansea University and one of the project leads for the Global Drug Policy Index. Thank you. The floor is yours.
Thank you, everybody. I realize that I'm literally what's standing between you and the coffee break. So I will keep my remarks extremely brief. With that, I would like to play a quick video that we have prepared to tell you about the Global Drug Policy Index. Gentlemen, please.
The Global Drug Policy Index is the first tool of its kind to document, measure, and compare countries' drug policies worldwide. Produced in collaboration with hundreds of experts from civil society and academia, the index assesses both policies on the books and implementation on the ground. Countries are scored on the basis of transparent, up-to-date, and reliable data. The higher the score, the more drug policy in that country aligns with the United Nations Common Position on Drugs. The index is composed of 75 indicators, grouped in 21 thematic policy clusters concerning 5 dimensions: the absence of extreme sentencing and responses, such as the death penalty and extrajudicial killings, the proportionality of criminal justice responses, including decriminalisation, health responses, and especially life-saving harm reduction services for people who use drugs, access to controlled medicines for the relief of pain and suffering as required by the International Drug Control System, and finally, development, focused on programs that provide alternatives to the cultivation of crops used for illegal drug production. Through this prism, the index assesses national drug policies, initially looking at 30 countries from across the globe. The index data reveal that, despite having a broad range of constructive options at their disposal, governments continue to prioritise punishment over support. The index's average score is only 48 out of 100. This should be a wake-up call towards reform. Government approaches to drugs vary hugely, especially between the global north and global south, in no small part due to the legacy of colonialism. It is in the interest of communities worldwide to disinvest in the costly war on drugs and move the funding into policies focused on health and rights instead. While punitive drug policies impact all people in contact with the illegal drug market, they are particularly harmful for people who use drugs and disproportionately affect people on grounds of socio-economic status, gender, and ethnicity. To learn more about the index, explore the data, and discover how you can use it to advocate for better drug policies in your country, visit www.globaldrugpolicyindex.net.
Okay, so listen, you know, you guys are fighting the good fight here, and we just want to give you another weapon with which you can fight against all of the problems that we've just heard about in the last two panels. I was so delighted to see Senator Ruane on the panel today. You might tell that I'm also from Dublin. And unfortunately, voices like Senator Ruane are in the minority in Ireland, where I come from, and in many places around the world. What we would like you to do with the index is to use it as a tool, where possible, to humiliate your politicians for their epic failures in matters of drug policy. It's literally as simple as that. The only other thing I would say, because I am a methodologist, and that was my role on the project, is to please engage with us, look closely at the methodology, tell us what we've missed, you know, criticize us, and we want to make this an ongoing project where we improve the way we measure drug policy and expand the number of countries within which we measure it. And we hope to have your help in doing that. Thank you very much for your attention.